So I want you to take a look at something that I'm noticing on this walking pattern. A couple things. First thing, we're going to start by watching the feet. This is slowed down to 1/10 of the regular walking, and this is using the grayscale 100 frame per second. This individual, as she's walking, she does have orthotics in her shoes, and she does, I believe, use a stability shoe. I'm going to bring that up again when I pull up her report in just a minute, but I want you to see where she's hitting on the ground, just from where her heel is hitting from the right side, and then where her heel is hitting from the left. So it's a pretty thin line. And the other thing I want you to notice is if we were to draw a line, which I'm not going to right now, but from where her foot hits, and if you can just think about the pressure, the ground reaction force. So for every action, there's an equal and opposite reaction. So every time her foot hits, she's going to have ground reaction force coming back up and through the joint. Okay, so then it comes directly up this way. Now watch, we're going to go up a little bit higher. It happens on her right side, but really I want you to watch almost this violent, I'll call it a violent internal rotation that happens when she has heel strike and progressing into the stance phase. So now that I'm starting to point it out, I want you to specifically watch. She's got EMG sensors on here. They make a good reference point for us, because if you really watch and see where they are right before they hit and how quickly they go to the midline. So here it comes here, and you can see almost like a whip type of sensation. So watching her whole leg and how quickly it just drops right into internal rotation. And on her left leg, you can really see her calf do a quick internal rotation as well. Boom, right there. And you can see that goes all the way up. Now, if I said this individual was having problems and pathology in her left hip, after watching what we're seeing here, it probably wouldn't be very surprising that every step that she takes, that boom, has that massive amount of internal rotation, which biomechanically we know that the body needs to be able to internally rotate. But now let's go back to what we said in the beginning. If she's in inserts / orthotics, I didn't even ask if they were rigid or, what type they were, but orthotics on top of stability shoes, I'm not sure how much subtalar motion she's getting. Now, the fault that I had was, actually, I did think I did record her walking barefoot. So we're going to take a look at that as well. But I just wanted you to see in slow motion just that this violent internal rotation, we're going to call it violent internal rotation, which for somebody to have a hip pathology after watching this, it's starting to make a little bit more sense. So now we're going to be watching the same individual as she's running on the treadmill. I think she got to 5.0 miles per hour. She has said she's not much of a runner, but and I think after watching some things on this video, we can see why, because it's not comfortable for her body. Just because of how her body has accommodated the forces. And we know that when we go from walking to running, it increases the pressure, the percentage by as much as 3 to 6% of the body weight, the force that's on the joints. So if we saw the malalignment while she's walking, we know that it's just going to be magnified when she's running, which is why it's not fun for her to run. So let's take a look here. I've got it slowed down to 1/10 of the speed again. So a couple things to take notice of. It's really hard to see the internal rotation whip that we did before, but something that I was paying attention to, again, is where her feet are hitting the ground. You can see that she's got almost like what we call a crossover type of pattern. So she doesn't have a leg whip or anything like that. But the big thing is, and I'm going to slow this down so we can do frame by frame here, is to see what happens particularly with this left side. So she's coming in, and you can start to see right there, and we know that we hit the ground on the lateral aspect of the foot. But watch, I'm going to back it up a little bit so we can do it in slow motion. The crash that comes down right there, and how hard her ankle will just drop into eversion, and then the rest of the body just kind of follows along. So we're going to look at that again, and again we're going to go slow motion, just comparing the right. It does it as well, but just not as much. But the part that's really significant, I think, and again, I'm always open for more feedback because I don't know it all, but as she hits here, this left side really hits hard, and that drops in, but she still has the tibia, doesn't really get a chance to go through internal rotation because, and this is my theory, because her foot motion is blocked with the inserts slash orthotics, and she's in a stability shoe. That's where that motion comes, and she just gets that drop inward, but the body still understands it needs to get internal rotation from somewhere because it can't unlock at the subtalar joint because it's blocked down here, and the tibia is not able to produce internal rotation. I think that's why she's getting a massive amount of internal rotation. Her body is compensating up at the hip. So for this unlocking that needs to occur down at her foot at the subtalar joint that's blocked, she's getting that massive amount of internal rotation, twice as much motion up in the hip where we need it to be down here in the ankle, which, again, we're going to let this play and watch what happens and how much motion she gets of it, her foot just dropping in and crashing on the ground. The question is watching this and saying, wow, do you have Achilles pain that ever bothers you? I think she has had some issues with plantar fasciitis. Again, we can see why, because of the amount of crashing down. And this is all going to make sense when we look at her report as well and see what's happening with the gait lines. As a matter of fact, we're going to do that next, but I just wanted you to see. I'm going to slow this down one more time so we can do frame by frame and show you again. If you think about the ground reaction force that's happening when that foot hits, and we're going to particularly go to mid stance. So right there, it smacks on the ground, and she's coming down, dropping down lower, right about there, okay? So you can see if we follow along, she's starting to come out of it right now. So back it up one more time, right about there. So if we followed the pressure, so the ground reaction force, and again, her tibia is externally rotated, or you could call it tibial varum, however you want to refer to it, but as driving in the opposite direction. So if you think about the torque that's taking place here, and it's all hiding up in this left hip, which is what is basically chomping away at her hip socket and where she's getting this impingement from. So if we drew a line again with the force coming up from the ground, it's going directly up into the anterior aspect of the hip where she's having a lot of the impingement in that extra motion there. Here's a quick view of looking at the myopressure. This is basically looking at the force plate that's inside of the treadmill. So right here, this is her left foot strike, and coming up right there, that's her right foot strike. So there's left and right. So you can see if this is the midline and where her left and right feet are hitting the ground, and that's her left foot right there that almost crossed all the way over to the right side. There's the right side that, again, is crossing that midline. So, again, if you think about the ground reaction force that comes up in a foot that basically hits directly underneath the body, that puts tremendous pressure, particularly on the the hip socket, especially that anterior and inferior aspect of it. And so it really cranks on the labrum, or the cartilage that's in there designed to protect the hip. Again, left foot and right foot. So the different stacks, let's get a different view here. This is kind of one of my favorite views. And again, it's hard to see in this one, but it gives you an appreciation for what we're looking at is these towers just show with how much force. and where the force is being placed the most. And this will come in a objective form on her report, which we'll look at next. And we'll be able to see that she does tend to strike harder on the outside of the right foot. Let's just pass through here, and then as she's starting to put weight through, evens out a little bit more, and then there's hardly much at all through her toe off. So she very much is landing on her heels, not much through the forefoot. Okay, so we'll take a look at the report now. Okay, so taking a look at the report here, I'm going to start off. I did a myo pressure report, bilateral gait report, and so what we're looking at here, it's just the average pressure, and you can see there's a little bit more on the right side than the left, and you can tell because we're going to get down to this little diagram here, and this shows the force reading there, and the more the red, that there's more force there. So it's interesting that on her right side, and this is the max over here, on her right side, she tends to hit more on the outside with the right, but on the left side, the majority of the pressure starts on the heel, and there's a fair amount on the inside, which is what we saw from the video. This is the part that's really significant to me, that when we're first looking, this is a center of pressure diagram, and this left side is the red is the left leg, green is the right leg. Each one of these lines represents a step in the whole time that we've recorded her. This graph is her running at 5.0 miles per hour. So this is what her running looks like. Now, this is really significant to me. I've not seen one like this before, so that makes her unique, in that she strikes laterally, but has such a sharp line changing over to midfoot here, and that I do believe is what I had mentioned in the beginning about orthotics on top of a stability shoe. So again, her foot is not able to get into subtalar pronation. Again, this is my theory, and that's why her hip is doing twice as much work. It's a lot more uneven on the left side than the right, but they both, you can see there's a significant amount. If this is plotted right here, this butterfly in the middle, this is the center of pressure butterfly, and you can see, again, just how asymmetrical, again, if we were to try and compare, this butterfly just has a unique shape to itself, but going from heel strike to toe off, and then how she transitions from one side of the body to the other. So again, you can just see that there's some asymmetry going on there. We're going to jump down a couple different parameters. There's one other thing I'd like to go over, which is what, so under the gait phase parameters, this is interesting. So she's pretty symmetrical when it comes to the amount of time she's on the left leg and on the right leg. So that's pretty good. Nothing different there. But if we go down here to the spatial parameters, is this. And so what the foot rotation is describing is, if we were talking about gait in a forward motion, what the rotation means is how much she deviates from that forward motion. So what we were able to see on the video is exactly what's picked up here in the report, is that the left side deviates 9.1 degrees and the right side deviates 8.2 degrees. So she's got a fair amount, but that left side is more so than the right, which puts more of an angle on that left hip, which is where she's getting her impingement from. So the only other thing here on this, again, right, one of the things that her cadence was at 166. So an ideal number, if she was going to be running, was to get a little bit closer to 180, because she wouldn't have as much ground contact time, which wouldn't put as much pressure or pinching on that hip. But that's a whole separate thing. But it is nice that that's calculated for her. But so if she did, again, want to pursue running, we'd be making some changes, and that would be one of them, try and get that cadence a little bit higher. Again, it doesn't mean anything with speed. It just means the step turnover, so she doesn't have as much pressure on that hip that's being impinged. So there you have it from the report, and I'm going to talk to this individual and just go over this with her, but I'd like to thank her for letting us take a look and giving us some more data to try and figure out. Thanks.